The number of children hospitalized with COVID-19 is increasing as the Delta variant continues to spread, the Centers for Disease Control and Prevention said Thursday, with the trend most apparent in places with low vaccination rates. The increase in hospitalizations is not due to the Delta variants making young people sicker compared to previous variants, said the CDC's director, Dr. Rochelle Walensky. Full coverage of the COVID-19 pandemic. Rather, there is simply much more transmission, meaning more children are exposed and therefore infected. More children have COVID-19 because there is more disease in the community, Walensky said at the White House COVID briefing Thursday. The overall number of children in the hospital with COVID remains low. The American Academy of Pediatrics reports that as of August 26, children comprise just 2.3% of all COVID-related hospitalizations. But the rise is of particular concern as schools are reopening, with the majority of young children and teens unvaccinated and, in many cases, unmasked. According to CDC data, the rate of new COVID hospitalizations among children has soared past the winter peak. The hospitalization rate is up by more than 11% since the previous 7-day average. The rises in pediatric COVID hospitalizations are most apparent in areas where vaccination is not widespread, Walensky said. Cases, emergency room visits and hospitalizations are much lower among children in communities with higher vaccination rates, she said, referring to 2 studies the CDC is scheduled to publish Friday. One of the studies, which looked at hospital data collected in July, found that the hospitalization rate among unvaccinated teens was nearly 10 times higher than for fully vaccinated teens. Download the NBC News app for full coverage of the COVID-19 pandemic. Another set of data, collected last month, found that the rate of hospitalization for children was nearly 4 times higher in states with the lowest vaccination coverage, Walensky said. States with the lowest vaccination rates include Alabama, Idaho, Mississippi, West Virginia, and Wyoming. Less than 40% of the population has been vaccinated in those states. The executive vice president of the Robert Wood Johnson Foundation, Dr. Julie Morita, a pediatrician, said it appears the data Walensky discussed make it clear that high levels of vaccinations in the community can keep hospitalizations among young people down. In other words, surrounding unvaccinated children with those who have been vaccinated can help protect them. Vaccinations for kids ages 12 and up have been available since the Food and Drug Administration authorized Pfizer-BioNTech's vaccine for ages 12 to 15 in May. Nationwide, 18.3% of children 17 and younger have had at least a first shot, according to data collected by the Mayo Clinic. 14% have been fully vaccinated. All data is taken from the source, http://weeknews.com. Article link, https://www.weeknews.com/health/health news/pediatric hospitalizations rise less vaccinated areas Delta spreads net 1875. #children #newsbc #newstoday of #newsworldfox #newstoday Donald Trump #newsworldnow